With my patients, I usually tell them the core medications for bipolar disorder are usually lithium, Lamictal, and Depakote, and also fish oil. Then there's a number of other medicines one can add in. Now, the reason you use multiple medicines is that multiple medicines work better. If you've got a person on 3 or 4 medications in a low to moderate level, they're going to work better than one medicine at a high level. And also, you usually get less side effects because you're having a low level of several different side effect profiles. And also, they probably just work better because they're going after the problem from different angles. They're each doing something else. When one can find somebody who one medicine works and that's it, that's fine. And we just do that. But many people just do not come all the way to normal on one medicine, and then you want to add things in. With Depakote, I try to use a low dose in the beginning. If they're really agitated and terribly out of control, I'll go to a high dose fast, and I'll tell them we're going to a high dose and you're going to be sedated. But in general, I'd start out with low dose, like 250 a day, and maybe 500, and take it all at night, and then they have minimal side effects and they have a good experience. Now with the Lamictal, almost everybody needs 200 milligrams because for seizure disorders, you have to have a level between 5 and 20 nanograms per milliliter. When you get somebody up to 200 milligrams, which is the standard dose for Lamictal, their level is usually only 2 to 3. And friends of mine tell me that I should push it above 5, and it's just a huge proportion of the patients don't need to go any higher than 200 milligrams on a level of 2 to 3. If they don't get better, if they're still depressed on that, then I'll push it higher and get them to a level above 5. But levels below that are not going to work usually. 100 milligrams sometimes has some benefit, but it's very rare that it's going to bring somebody to a normal mood. With lithium, I'll start them out at 150 milligrams, where the normal dose maybe is 1,200, even 1,500. But I like to start very low so that I don't give the patient a bad taste about taking lithium. Because sometimes once somebody's had some bad side effects and they've heard negative things about it, they don't want to ever try it again. When actually, if you take 1/4 of the dose that you had a problem with, you're probably not going to have much of a problem. But I like to start out low with that and then let them get accustomed to it. And often a low dose will have an antidepressant effect, even 150 or 300. And interestingly, with lithium, lower doses have a better antidepressant effect than a full dose. So I'm usually not in a rush to use a big dose of that unless somebody is bipolar 1 and in terrible shape, or they have a history of being a person who only responds to lithium. Then I'd really want to push the lithium. In 1999, a fellow did a paper showing that people with recurrent depressions, who I believe were bipolar 2s, did much better on fish oil than on placebo. And since then, there's been over 10 papers demonstrating this. And these were double-blind control studies where the patients didn't know who was taking what and the doctors didn't know. And in virtually all of these studies, the people taking the real fish oil had a much higher percentage of people who do well. So I began using it a lot back then and still use it, and I find perhaps 50% of my patients do better when they're on it. At least those patients who, if they're a little below normal, if I get them on fish oil, they'll feel better. If people are still unstable and very agitated, then one might add in an antipsychotic in a small dose, like Seroquel or Zyprexa, or 2 that seem not to cause much or any weight gain are Saffris and Latuda. And and I'm also leaving out Geodon and Abilify, which are also both very good, and both of them are very low in weight gain. And these medicines also help out with both the depression and the highs usually.